Hi, I'm Kelly Bethel, PT, E-RYT, and creator of Tafiya Yoga and Wellness, Tafiya Yoga for Stroke Survivors program, and Tafiya Yoga for Brain Injury program. Today, we're going to demonstrate a simple breath practice that can be done at home. We will give you a series of options so you can work within your capabilities. In yoga, we honor our bodies where they are each day. So I ask, as you go through each sequence, that you, 1, listen to your body and proceed at your own pace. 2, let go of any expectations, let go of any judgment. 3, if you become anxious or something doesn't feel right, stop. And 4, never force a position, grip, or pull while practicing. Namaste. Windshield wiper pose. For this pose, you'll need to either be lying down on the floor or in a bed. You may have a small pillow or blanket underneath your head for comfort, but take care that your neck is not either too flexed or too extended. Ideally, we like your chin pointed towards the ceiling. Some options as we work through this pose are to work like Ruth is, using both legs. If you find this pose challenging for you on one side, especially if you're finding that your leg is flopping out to the side when you move it, then you can have a spouse or family member help you, like Catherine and Julie are doing. As we begin to work through this windshield wiper series, remember to listen to your body. If it's not feeling right, then it is probably not correct, and you need to stop. So we're going to start with your feet flat on the floor or flat on the bed. Your feet are hip width apart, your knees are bent, and your sacrum and tailbone are snuggled into the floor. The feet are pointed forward. And take a moment here and check in with your neck and make sure that your shoulders are down. As we begin to move through this pose, we keep the sacrum and the pelvis down on the floor or the bed, and then we begin. So take an inhale in, and on the exhale, let's begin to drop the legs over to the side. We then inhale up and return to center. On the next exhale, we drop the legs over to the other side, and we inhale up to center. You may find that one side of your body is tighter than the other, and that's okay. That's just how your body is. Make sure that you're letting your back dictate how far over you drop your knees. Repeat this pose 5 or 6 times on each side. Remember, this is not a twist, and although your hips will come up just a bit, your tailbone and sacrum stay down on the floor or bed. Remember to focus on small movements. Make sure that your involved side is going slow. Try to avoid any flopping of the leg. And as you return to your starting position, we'll move on to the second part of this pose. So for part 2, if you're using a yoga mat, you may move your feet greater than hip width apart. And with the yoga mat, ideally the sides of the mat are perfect. Keeping the sacrum and pelvis on the bed or the floor, we repeat the same process. We take an inhale in, and on the exhale, we begin to drop the knees over to the other side. Let the inhale pull you back up to center. And again, we then exhale and drop the knees over to the other side. When you're ready, inhale and return to center. And just like the previous version, one side might be tighter than the other, and that's okay. Continue to flow with breath 5 or 6 times. Let your back dictate how far over you drop your knees. And again, it's not a twist. Your hips will come up a little bit, but your tailbone and sacrum stays down on the surface that you're lying on. When you finished your 5 or 6, return to center, straighten your knees, and breathe. If you're finding windshield wipers particularly challenging on one side of your body, then have a family member or caregiver assist you. things to look out for to see if it's too challenging for you is if your involved side is flopping out to the side uncontrollably, or you just don't have enough strength to make the leg move. Let me show you what that might look like if someone's assisting you. So we're going to have Catherine here take an inhale in, and on the exhale we begin to drop over towards the other side. And I'm just helping her on involved side, just making sure that it moves slow and controlled. We then inhale back up to center, and then on the next exhale, she'll drop over to this side. So I'm just taking care to make sure that the leg is not flopping out one way or the other, and it's staying in nice alignment. And again, just moving with breath. Let the exhales carry you over, and the inhales carry you back up to center. And you can flow through this 4 or 5 more times. When you're finished, return to center, straighten the legs, and just take a few breaths there.